David, if you would like to answer that question.
Yeah, thank you. I think with COVID, the world has learned how to do business in another way. So looking at the connection across the globe, I remember we introduced webinars, and we had very good participation. So I think the shift to online education for health workers during the pandemic accelerated the acceptance of distance learning. So this is very positive. Also moving forward to make enhance accessibility, flexibility, and in training. So in the context of AI, distance education allows for integration of cutting edge technologies. So ICAD Africa tried to adapt the learning situation and the data-driven insight, potentially offering more personalized and efficient learning experience compared to the traditional method that we used to use previously. I think there's a very shift that we keep observing the shift due to the pandemic period. Thank you.
Great, thank you, David. And there's a question here from Mustafa Hunter about, do health workforce regulatory agencies have the capacity to govern AI in health worker education, and what type of capacities would they need to develop? And David, if you could answer that, being on the ground in Rwanda.
Now we do remote trainings, so it depends. We do everything now we can do remotely. So we do train people from different countries. Then they access, they have access. They have the first thing is just to have the connection, and then we do train, we do provide exams, and then we see a very positive feedback. I think there is a lot in that area of AI, and also the accessibility. So the fact that people there's this flexibility as well, so people can access through their smartphones. So giving an example, we have kind of university, a virtual university called Websurge, where people do register at free of charge. You can access this platform using a smartphone, laptop, and desktop. So and then follow and have courses and have everything happening there. I think it's very good, and it has a very positive impact.
Great, thank you so much, David. I think that definitely regulatory bodies everywhere will need significantly larger budgets, and will need specialized staff in AI to handle the regulation as AI gets more and more integrated in both health worker education and practice. So with that, I'll wrap up this panel and hand it back over to Egbe. And after Egbe's panel, hopefully we'll have some more time for questions.
Thank you very much. Thank you very much, Kate. I mean, I think that was interesting, and there's some interesting sort of questions. And somebody noted today was Universal Health Coverage Day, which is actually seems a really interesting conversation to be having on technology today. So for our panel, the next panel, we are going to be focusing on looking at is artificial intelligence a friend or foe to clinical practice, and really looking at some of the potential and the potential perils of artificial intelligence in clinical practice. So to discuss this, I'm going to be first asking Mr. Amer Abodre, who's CEO of Rology, who has been using sort of AI in the space. And we first came across Amer during the COVID pandemic, which now seems like a very long time ago. So what I will do, Amer, is if you can introduce yourself and just a few words on how you got into the AI space. You have like 1 minute. Thanks, Amer.
Okay, first of all, thank you for the opportunity and thank you for the invitation. It's really my pleasure to be here. I'm Amr Abodre, co-founder and CEO of Rology, which is an AI-assisted teleradiology platform that helps hospitals and radiology centers to solve the problem of the severe shortage and the misutilization of radiologists. So we help hospitals by connecting them with radiologists through our zero setup cost platform. And on the same time, we boost the productivity for the radiologist and enhance the quality of diagnosis through our AI vehicles and our AI algorithms. How me personally got to the AI field and the AI landscape, I believe it's it's not a choice. It's not like I'm choosing to go through the AI and all of this stuff. I believe all of us as we have to adapt with such technologies and so on. So we have problems and we want to solve these problems. And I believe this is the core of the entrepreneurial mindset to solve this problem. And to solve this problem, we have the digital technologies and the digital solutions. And the next step for any digital solution is the automation. And after the automation, it's the intelligence overall. Yeah, I know it looks like very naive steps overall or description, but I believe it's something extremely important when you think about this, like from the problem perspective, even for the AI, even for the intelligence part, how you can go through the AI and AI technologies to solve a problem by the end of the day, not as not for fancy purposes, if we can say that.
Okay, thank you very much, Ahmed. We'll come back to you. I would like to call on Kurt Waltenberg. So, Kurt, can you introduce yourself and why did you or how did you get into the AI space?
Yes, good morning. So I've spent the last 30 years building companies around consumer behavior and using data about consumers to predict and forecast an outcome and then use that outcome to influence behavior change in some way in a variety of industries. But what got me started down this path was about 30 years ago working in the retail space around fraud prediction. And what we learned was that actual behavior in large data sets is really the best predictor of future actions, which is really what all of the AI technologies are based on. But at the time, one of my data scientists was accessing Visa and MasterCard data about credit card spend and made the interesting connection that using that data, we could predict divorce 6 months in advance. By looking at how the spending patterns changed over time, bankruptcy about 9 months in advance. And that was really the first indicator that set me down this path that things that happen in the world, how we make choices, how those choices are recorded, that data can be used to predict the outcome. And so fast forward to the last 10 or 15 years, my team has been using data and algorithms and now artificial intelligence to predict behavior around healthcare. And effectively, what are the things happening outside the four walls of the hospital that are driving risk? Most of our lives are lived outside. Healthcare clinical data is necessarily retrospective after we're already sick. But by using consumer behavior data, by using information about the communities in which we live, we can identify barriers that are preventing health and work to remove those from the system. And that's really the angle that we bring to the AI discussion.
Thank you so much. Kurt, will be back to you, but I think that's a very interesting perspective. And I like the fact that you could predict sort of you looked at non-healthcare stuff first, things that affect people, before sort of focusing on healthcare. So I think there'll be some questions. I'll also like to ask Dr. Marcus Rennie, can you introduce yourself and please let us know why or how you got into the AI space?
Hi, everyone. Good evening from Mumbai in India. Thank you for having me here on the platform. I'm Marcus. I'm a longevity physician and an incredibly frustrated one. Over the last 20, 25 years of clinical practice, it's been disenfranchising for us to practice in a paradigm which is very sick care and disease focused. The world went through a massive amount of change through the pandemic, with us realizing the importance of our health and well-being and us being our best self for as long as possible. And I founded a company 3 years ago called Human Edge, which I'm the founder and CEO of. And our efforts through Human Edge are really to bring together the worlds of biology and technology, where we can align various streams of biomarker data, whether it's bloods, wearables, new types of diagnostics platforms, including some of the types of data sets that the speaker before me was just mentioning, to understand an individual's biology and then help them nudge themselves in a healthier behavior to really change the arc of their healthcare health span slope over a period of time, preventing disease, mitigating it before it becomes serious, and optimizing ourselves to be the best version of ourselves.
Okay. Thank you so much. I mean, that's a very interesting perspective. And I think when you think about the issues of the predictive perspectives, I mean, when you think about some of the countries where NCDs are becoming an increasing problem, and one of the issues I think in the earlier panel about having no sort of legacy systems. So for many emerging markets, really looking at how maybe you might be able to apply this to NCDs might be a way to prevent some of the sort of present cost structure of treating NCDs in the US and in other OECD countries. But so to go back to the questions again, Amar, how are you using Rology to improve sort of clinical outcomes, on focusing on radiology, as you mentioned, or do you have any examples? Do you have any, have you done any studies yet that has proven that what you're doing is actually improving clinical outcomes?
Yeah, so thank you for the question, actually. So we in Rology, we have the laser focus around the medical imaging and diagnostic, radiology diagnostic purposes and so on. Our main focus for the AI, it's mainly for diagnostic purposes overall. And we believe that just to train the AI to do the same level of quality, the same level of diagnosis like the radiologist, it's not something enough. You need to have an add value for the AI overall. So if the radiologist can diagnose the lung cancer, as an example, from CT, it's something extremely important to train the AI for early prediction and early diagnosis for lung cancer, as an example. And we have this algorithm for CT as from CT chest as an example to predict and also at the same time to early diagnose the lung cancer as an example. And this is something, it had the clinical outcomes for the patients automatically by even early diagnosis or even the prediction. So you help patients to get early treatment and better treatment and to enhance the probability of curing for these patients overall. And this is one of the examples we have in Rology, and this is the main mindsets we are working on, the AI and how we can reach the better outcomes, the clinical outcomes for through the AI overall.
Okay, thank you very much. Amara, I'm going to come back to you and we can think about it, because there's been a lot of conversation about the sort of generative AI, because a lot of the conversation we've been having so far has been about sort of predictive and using previous data. And so I'll come back to you to see what you're thinking about in 5 years, whether generative AI might change what you're doing and how it might change your issues. Court, from your perspective, can you give any examples of how AI has improved clinical outcomes, or is this still a hypothetical situation? What do you think?
No, absolutely. So a great example is using AI in conjunction with predictive data to personalize and tailor interventions. So if you think of, for example, in our own data set, we see that pet owners, people who own dogs, for example, who suffer from chronic illnesses, have better outcomes than those with no pets. Now, when you dig into the clinical reasons for that, there are a number of factors that are overlapping. One of which is there's a slightly higher level of fitness required to own a dog. It's not causal per se, but the fact that there is a pet in the household means that we're seeing an individual with slightly more fitness levels than that non-pet owning peer group. So by knowing that, we can identify, and thousands of variables like that, we can identify where risk is at a very precise level and identify what the needs are for that individual in that household. The challenge then becomes, what's the intervention? And what we've learned, and this is where AI comes to the fore, is it's not a one-size-fits-all intervention. People don't respond the same way to the same stimulus. Some people respond to a reward. If you're going to offer them a small monetary sum for behavior change, some people are very eager to go down that path and to achieve that goal. Others respond better to social pressure and having a community of people who help reinforce behavior change, and they need that individual sort of group conversation. AI helps us detect what type of person and what type of nudge they need to be able to make that behavior change initially, and then to reinforce that over time. And so the real clinical advantage is we can get down to that truly one-to-one personalized level of medicine and intervention, both in the clinical and non-clinical setting, by better understanding motivation and behavior change.
Okay, thank you very much, Kurt. I mean, there's some conversation in the chats really about looking at the issues of NCDs. And so we'll also come back to you to think about what else can be done or in the future. Dr. Rani, do you have, so what do you think, any evidence of AI sort of improving clinical outcomes? And there's some, do you have any examples or that this has been done as opposed to just a theoretical conversation?
So we saw a few, a bunch of different models that happened during the pandemic here in India. I think your point around this being a very interesting tool for not just the developed markets, but a lot of the developing markets as well, to address some of the issues of inequitable access to professionals and experts, and how technology can allow us to leapfrog that is a very strong one. We saw examples here during the pandemic of different applications on mobile phones being provided by the telecom providers, listening into the voice, the cough, and thereby being able to stratify the risk for pandemic, for COVID versus other types of infections. That's one thing which was released during the pandemic. Increasingly now in the space of diabetes, we're seeing a lot more technology companies that are using different algorithms on the back of the glucose monitor patches, basically because India is the diabetic capital of the world, and we have a large number of people with pre-diabetes and metabolic syndrome as well. And using some of the nudges, some of the food insights, etc., to manage an individual's disease or pre-disease and prevent them from tipping over into disease. So these are just sort of two rough examples that we're already seeing in the market today, in the hands of customers and consumers, which is trying to prevent diseases and pick them up earlier before them having to see a doctor.
I think that's so interesting, because that really, as you said, can be really insightful that now we have more data. I think there had been some conversation in the chat from Professor Adikile looking at sickle cell. And you said, like diabetes, I trained as an endocrinologist, where, in those old days, people used to measure their sugar every couple of hours. But now that you can see, and most of the research, as you know, had been done on food in the West. And so I suppose now in India, you have different, you can have different things on, sort of Indian specific foods on how it affects, the sugar. So we're seeing AI people of the future. So on how it affects. So I think this is really interesting. So Amir, I'm going to come back to you. From your perspective, where do you think AI will be sort of bringing the most impact in 5 years? And I'd mentioned to you about this whole idea of Because a lot of the examples we're talking about today is what AI is today, which is basically much more predictive. And in some ways, it's really as good as the data underneath it. I mean, some of the challenges is really some of this can continue whatever stereotypes or whatever issues that may have been in the formal system, in the in the non-AI system can be continued, in terms of the from predictive perspective. So what do you think about all those new conversations around generative AI where, it can go beyond what's, has been put in? Is this something that you think has an impact in healthcare? Will it have an impact on your business? What do you think?
Yeah, definitely it will have an impact, not only in my business, not only in the healthcare, but in all over the human history overall. But when we think about the AI and the generative AI also as well, which is the modern AI, if we can if we can call it like this, I believe one of the very important aspects when it comes to the healthcare, which is personalized healthcare, it will be extremely impacted by the modern AI and how we can deliver specific healthcare, even specific medicines, personalized medicines, and so on, which is through the AI, not only AI alone, but through the technology and in the core of it, the modern AI in general overall. So the personalized medicine, it's something very, very, very tough to do right now because of the cost issues and the resources and all of this stuff. And I believe AI, mainly as a technology, will remove these boundaries for the personalized AI and how we can think even about personalized medicine, personalized diagnosis, and all of this stuff. So I believe in maybe most probably it would be less than 5 years from now, we will have we will see a totally different medicine practice overall based on such a technology in general.
Okay, thanks very much, Amer. Kurt, from your perspective, and as I said, sort of given the new research and sort of the continued research on AI and its capabilities, what do you think, or where do you think the major changes will be in 5 years?
Yeah, great question. I really see 3 areas that are going to be the most impacted, and one is efficiency, right? More rapid decision making that's able to take into account all relevant data points instantly. AI gives us that at sort of every point in the supply chain, every point in the decision making process, in a way that we just couldn't afford to do with human intervention. Information dispersal is a second area that we're able to deliver accurate diagnoses, accurate information that were previously reserved for highly trained professionals. We can deliver those at the consumer level, which will change the relationship with primary care and the relationship that consumers have with the healthcare system. Which sort of leads into the third point there, where I think I'd like to spend the most time over the next 3 to 5 years, and that's really around AI-driven coaches. We can't afford as a healthcare system to have every person